Good morning, everybody. Thank you so much for joining us today for this awesome panel that we put together. We're labeling our panel Respond, Recover, Rebuild, and we're hoping that this is the first in a series of conversations that we'll be having with everyone. Before I get started and introduce the panelists and the agenda, wanted to talk a little bit about a study that recently came out. And the study talks about how 60%, they polled Latinos nationwide, and out of the Latinos that they polled, 60% of Latinos said that they know someone who's either lost a job, has taken a pay cut, or has been furloughed. It's the 70% of those Latinos that they polled nationwide said that they were feeling anxiety because they were at a point where they felt that they could not and would not be able to pay for their basic needs like mortgage, rent, utilities, and food. Of those polled in the state of Illinois, that number jumped up to 80%. And as we know, 60623 has been the hardest hit zip code in the state of Illinois. And one of our panelists is going to talk a little bit more about that. But I just wanted to let you know about this national study that came out that really starts to outline what the Latino community is going through, not just in Chicago and the state of Illinois, but across the country. So on the screen right now, you're going to see who our panelists are. You should have received an email this morning with everyone's bio so that we can save a little bit of time, but we will introduce ourselves, our names, and our organization. My name is Luis Gutierrez. I'm the CEO and founder of Latinos Progresando. So if we can go down to slide 2, please. So really quickly, this is just an overview of our agenda today. We'll have a welcome, community and network overview, the impact of COVID-19, our collaborative response, recovery with resilience, and then a dialogue. During the dialogue section, we hope that you will ask questions, but we're also hoping that you share what you've seen, what you're working on, and some best practices that we can take back to our network and share as well. So up next, our speakers. So like I said, our speakers are myself, Anna Mayer, Bella Mote, and Karma Vergara. And with that, I'm going to start off by turning this over to Anna Mayer, Executive Director of Taller de Jose.
Great. Thank you, Luis. And good to be with all of you this morning. Thank you for joining us. I'm going to start with just giving you a little bit of grounding in terms of what the Marshall Square Resource Network is, the community that we serve. So with that, just a general overview. Certainly all of our organizations serve the broader Little Village neighborhood in general, but the Marshall Square Resource Network in particular is a very place-based collaborative initiative that has really focused on the Marshall Square area, which is the eastern portion of South Lawndale, just because there's been a historic lack of institutional support and services in the area. So you can see here the general Marshall Square geography on the map. It covers Ogden to the north, Kedzie to the west, Rockwell Viaduct to the east, 31st on the south. It does include 2 different zip, 623 and 60608, and then does touch on 4 different aldermanic wards. So we have the 12th ward, the 22nd ward, the 24th ward, and the 28th ward, which certainly the different zip codes and aldermanic wards can make it difficult to coordinate resources in the neighborhood, but we focused a lot of effort on making that possible. So just in general, a little bit about the community. It is Marshall Square and the broader Little Village community, as many people know, is often referred to as the Mexican of the Midwest. So there's certainly a predominantly Latinx immigrant community in the area, and certainly a community with a lot of tremendous assets. Lots of creative, hardworking people, lots of entrepreneurs and family-owned businesses, pretty good access to public transit and boulevards, including Douglas Park, but also certainly a community that has faced a lot of historic challenges. So these numbers that you see are all prior to COVID-19. So the broader South Lawndale community, which these numbers are for South Lawndale in general, prior to situation, had a 15% unemployment rate nearly half of residents were food insecure, which, as we know, has only gone up in the recent months. And just want to highlight, especially to some of the challenges related to documented population, mixed status families. As we know, that's created a lot of difficulties with the stimulus checks. And it's also a very young community with 32% under the age of 19, which is really young as compared to kind of general averages in other communities, just making youth services particularly important. So the Marshall Square Resource Network, to help to serve some of those communities, it was launched in 2010 as a collective strategy by organizations in the neighborhood. And really it was in response to the Great Recession. So similar to other communities of color in Chicago, the Marshall Square Resource Area, or Marshall Square area, has experienced the effects of systemic disinvestment and racism over time. And as organizations, we realized that the recession was only going to exacerbate that impact. And so recognizing that residents were certainly impacted by the recession, and then at the same time, that was compounded by the fact that we as community organizations were impacted by the recession, facing, do we need to close? Do we need to scale back services? And that was a time when residents needed us most, right? And so 3 organizations came together to try to advocate for resources for the neighborhood and coordinate how we would offer services, how we could work towards policy initiatives, and how we could build capacity of ourselves as individuals, as organizations, and community residents. So from that kind of crisis response, the MSRN has grown to a much bolder, broad, collaborative approach to service coordination and systems change. You can see here, but 10 years ago, those 3 founding organizations, and now we have grown to over 45 institutional partners. So you can see here, those members and affiliates really represent a pretty diverse focus area with different budget sizes and service delivery models, which allows us to really benefit from learning from each other's expertise. As a network, our work is driven by a community plan that addresses 3 main areas. Those are health, peace, and education. And the Latinos Progresando is the network convener, which really provides backbone support and all those logistics that we need to best support our collective impact. And I'd just like to wrap up by sharing what I think is a really powerful vision that we have for our community. And that is a vision of a thriving Marshall Square community in which residents have the knowledge, capacity, and options to achieve dreams and to contribute to community well-being. So with that, I will pass it back to Luis to introduce our next speaker.
Thank you so much, Anna, for that presentation. I would like to introduce now Carmen Vergara, who is the Chief Operating Officer at Esperanza Health Centers. Carmen?
Thank you, Luis, and thank you, Anna. Good morning, everyone. Thank you for your time this morning. I'm Chief Operating Officer for Esperanza Health Centers, and I'm here today to talk a little bit about the impact of COVID-19, specifically on the Latino population, which has been incredibly alarming, scary for what we're seeing on the ground. And so I wanted to share a little bit of that information, both big picture and also zoom in a little bit to what we're seeing specifically at Esperanza. You can go to the first slide. So here are 2 maps from the Chicago Department of Public Health. And many of you might already be familiar with these. The department has been updating these maps on a regular basis, and it shows 2 different points of data. The first, over on the left-hand side, are the case rates by zip code of COVID-19, and then over on the right side are the mortality rates, and both of these are per 100,000 of people. And to start over on the left-hand side, what we're seeing is that areas that are in the deeper shade of blue are disproportionately affected by exposure and transmission of COVID-19. And if you look closely in the 60623 area, 60608 area, and then further down south, many of the areas that Marshall Square serves, we are seeing these hotspots that have been developing over the past 4 to 6 weeks. And now it's just clear that exposure and transmission, it continues to happen. If you align this map up with what essential workers look like, you see the similar shading here, where many of the folks who live in this area are essential workers who work in construction and production, manufacturing. And so they are folks who have been working since the pandemic started. And so it's at this point no surprise that exposure is happening in the place of employment. And then it's secondary compounded by not being able to isolate at home once someone tests positive. And so we see that the exposure and transmission is happening at home as well. Over on the right-hand side, we're seeing the mortality rate. And this here, 60623, is also in a deep shade of blue. This is also related to the chronic condition disparity in this area, that if someone has a chronic condition, they're more likely to have a fatal outcome with COVID-19 if they are in fact positive. What we're seeing, particularly at Esperanza, is that we've diagnosed a lot of younger patients with chronic conditions. And so although you typically see that mortality rate is of folks who are in the 60s, 70s, and 80s, those who are diagnosed with these chronic conditions in their 30s, 40s, and 50s are also at a really high vulnerable risk. We also are looking that this is the map so far, and it's super important for CDPH to continue to update these maps, because I do anticipate that you'll see some darker shades of blue continuing, as we know that there is a pathology lag in mortality once from the point that someone is first diagnosed with COVID-19 until they ultimately have a negative outcome. Esperanza's mortality rate has also increased in these last 3 months as compared to these same 3 months last year, and this is even after controlling for our growth over the past year or so. Once we, after looking at the bigger picture of what's happening in the city, and we zoom into what's happening specifically at Esperanza, as many of you know, we serve a primarily Latino population, so we've been doing quite a bit of testing since the beginning of the pandemic. Our first test was on the 14th of March, and since then we've tested over 3,600 patients, and of those patients we've had almost 1,800 confirmed positives. This is a cumulative positivity rate of 53%. It's, believe it or not, has gone down compared to where it was 3 or 4 weeks ago. At that time we were seeing rates in the mid-60s. There was even one day where we had a high of 72%. I went to bed with a knot in my stomach every day, just thinking about how these rates were surging. As of right now, over the past week, our positivity rate is 46%. 46% is still more than double of what the safe metric that we're looking at in terms of thinking about reopening. So we're still really concerned about these high positivity rates in the areas that we're serving. We are testing, about 52% of the patients that we're testing are uninsured. So we are making sure that everybody is aware that the testing, it's at no cost, and that they can come in without any questions related to their immigration status, and that we are providing not just the testing, but also the follow-up care, which I think it's really important, as we've seen that improper follow-up care has led to worse outcomes. Most of the patients who we're serving, close to 80%, are under the 100% of the federal poverty level, which is something that we acknowledge. We know that these are the patients who are the most at risk for exposure, just because they might not have had insurance before, might not have had adequate care, and so we really want to make sure that they know that they can come in for testing. And then our patient age, as I mentioned briefly earlier, we serve a lot of patients who are 30, 40, and 50 years old, and that's really who we're testing right now. And many of these patients have underlying chronic conditions, and this is why we're trying to make sure that we have them connected to care, because they are at higher risk if they are positive. So just to really to share a little bit about what we're doing on site, we are testing at 2 of our largest locations, and it's incredible to think that a year ago we weren't even open at one of our locations. And I can't even imagine what it would be like in the Brighton Park neighborhood had that health center not broken ground a year ago. So we are now testing at 2 locations, 7 days a week. Our average turnaround for results has improved. It's now a little under 2 days, so we're getting results quicker. We're adapting our care at Esperanza. So telemedicine is super important because, as I mentioned, we have a lot of patients with chronic conditions. We want them to stay controlled, and we don't want them to be more vulnerable if their chronic condition is out of control. And then for tele-behavioral health services, we're providing a fair amount of grief counseling now. We have had patients who've had lost relatives due to COVID, and so we're making sure that we're offering that service for them. In addition to in-person care. So we still want to make sure that we have our doors open for those really emergent essential visits. So we're making sure that we have that availability and that access open. And then probably the biggest impactful in terms of community-wide education is making sure that all of this COVID-related information is available in Spanish for patients. We have not really seen any place have like comprehensive, easy to understand information. And so we've been making sure that everything that we can provide is provided accessible and it's in the language that our patients prefer.
Wonderful. Thank you so much, Carmen, for that. I can't tell you how much we appreciate the leadership that Esperanza has taken on the Southwest side, especially at the beginning of this pandemic. The way that Esperanza ramped up their testing has been so helpful to everybody in the community. Thank you so much for your presentation. Now we're going to move into what our collaborative response looks like. And I want to talk a little bit about how intentional we are about both supporting organizations as individual organizations, but also bringing people together as a collaborative. So for that, I'm going to turn it over back to Anna Mayer so she can walk us through a couple of scenarios.
Great, thank you, Luis. So just kind of building on a little bit about what I shared about the network. I think one of the great things was that since we have been building over the past 10 years, we really have a lot of strong, trusting relationships built between organizations, with the schools in the area, and with community residents that allowed us to really move pretty quickly as soon as things started to hit a couple of months ago. And having that really solid infrastructure that we've built, having a backbone organization, actually having staff to work on the network has made it really easy for us to, or not easy, but has really facilitated our ability to pivot. Having established procedures, communication channels, the fact that we already had committee meetings on the calendar that we could continue to meet, albeit virtually, really allowed us to connect with one another early on to share about our resources. And I think one of the things, as Carmen's presentation shows, that we have experts in the network who are able to share their expertise. And so we're able to leverage that expertise of individual organizations and allow each of us to really focus on our niche and on doing that well, which has allowed us then to be really adaptable and flexible in this time. And then another key piece is that as a network, we've really worked hard to make sure that we have community voice. We've had community leaders working on all of our committees, offering social emotional learning and leadership within the network. And so already having those established relationships and ensuring that their voice was present in our response too was a really key part of making sure that we were putting community first as we responded. So just briefly, Carmen shared how Esperanza has adapted their services. Others in the network have also done a lot to adapt their service delivery. Latinos Progresando has started an immigration hotline. The Carol Robertson Center for Learning has been doing food distribution, which was a big shift for them. At Taller de Jose, we've really needed to shift our resources from what was previously sort of top of mind for our clients and community members to now a whole shift towards much more sort of immediate needs and responding to the current time, and doing all of that virtually to keep people safe. As many of you know, the schools have all become food distribution centers, and some of them helping to provide testing sites. And then we've also had to do a lot about how can we figure out how to engage community virtually, especially given a more limited number of residents with internet access and technology, and how do we make that happen. I think too that's really important is that we've, for example, coordinated with Open Center for the Arts and others on a public art project to try to congratulate the class of 2020. So beyond sort of those immediate basic needs, which are of course critical, are there other ways that we can really bolster sort of a sense of community, a community resilience when that's needed most in this time? So I'm going to pass it back now to Luis as the backbone organization to share a little bit more about some of those specifics of the network response.
Thank you so much, Anna. One of the first things that we did is really talk about getting protective equipment out to organizations. And so we received a donation from Sinai Health Systems of 16,000 masks. And so we engaged 14 community partners to distribute those masks. And what we did is really focus on the food centers. And so as people were coming to pick up food, we're getting masks in their hands, as well as information about our immigration hotline and the census. And so this is an important way of how the network works together in terms of getting one space that's attracting a lot of people and then distributing resources and information through that. One of the other things that we talked about is really getting dollars into the hands of people in the community. So the first thing that we did is Latinos Progresando does offer grants to members of our network. And with the support of United Way and a couple of other foundations, we were able to release in March $50,000 to different partner agencies so that they can use those dollars for emergency response in this situation. In addition to that, with the collaborative of organizations that are on this panel right now, we have been able to give out $60,000 to community members for rental assistance, and an additional $20,000 that's been focused on our business corridor to provide financial assistance for employees of restaurants who have either been laid off or who have had cut hours. In terms of information and resource sharing, one of the first things that we did is we put out a survey to not just community-based organizations, but also to community residents. We really wanted to give people an opportunity to tell us directly what it is that they were experiencing. And then we used that information to guide what our response was in this situation. From that, one of the things we heard is that there was a lot of information out there, but it was coming from so many different places that sometimes it felt like it was too much. So Latinos Progresando put together a community resource guide that we translated into Spanish, and we sent that out to not just our community residents, but also to our partner organizations, and said either share this with your community or copy and paste it and put it on your letterhead and you send it out as your community resource guide. Trust is really important in these situations, and while there are a lot of people that do know our organization and our network, there are community residents that really trust organizations like Taller de Jose, for example, that want to see a resource guide with their name on it. And so this was helpful in that way. The other thing that we've been doing is really sharing information about resources that are coming from the foundation world and from the city through our committee work. So every time we had a committee meeting, whether it's our peace, education, or health committee, we're getting out information to the participants directly. We also have a newsletter that goes out to about 600 people, and it's very community focused, that has organizations, community residents, and business owners that receive that. And so we use that as a vehicle to get resources out to people. And I think we keep saying this over and over again, but trust is so important. We all know that the CARES Act came out and there was an opportunity for organizations to apply for the PPP loan program. I'm really happy to say that of the people that are presenting today, 3 of the organizations received the PPP loan in the first round, and Taller de Jose actually received it in the second round. And this, among other things, has been one of the most stressful things to go through, especially in the first round. But being part of a network where we have trusted partners and being able to pick up the phone and call Carol Robertson Center and talk to Bella and say, Bella, here's what I'm hearing about the PPP loan program. What do you think? And having her share information with us, and we share information with Taller and sharing information with Esperanza, really made it so that we had higher success rate from the folks that applied from our network. So those are just some of the examples of how we come together as a network to share initial resources. The next thing I'd like to talk about is how we've coordinated with the city of Chicago. So I hope that you've all heard, but last Wednesday we put together a town hall with the Marshall Square Resource Network and Mayor Lori Lightfoot. In our debrief on Monday, the mayor's office mentioned to us that when they put out these types of videos, typically they get about 11,000 people that view their videos. As of Monday, we had received over 31,000 views for the video. So we think that was a huge success. And it just shows the need for information, accurate information in Spanish for not just organizations, but community members and businesses. So that was a huge success for us. In addition to that, we all know that when the Chicago public school system asked students to stay home and study from home, the first thing that we were worried about really was laptops for our students and our families, and that was a huge concern. But immediately after that, one of the things that we started thinking about was people really don't have access to the internet. And so how are we going to work on that? And so we started reaching out to all of our elected officials and saying, there is only really one solution. I went to one school and one school asked me for 150 hotspots. And we were thinking, the organizations at this point are trying to figure out how to get laptops for their employees. It's going to be really difficult for us to give hotspots to every single school. And so we talked to a couple of elected officials, and I'm happy to say that Alderman Cardenas on April 22nd introduced a resolution based on our advocacy work with his office that called on the city to explore possible options for free citywide internet access. And we see this really as a first step in our campaign to ensure that communities, particularly communities that are in lower income neighborhoods, get the access to the internet that other communities that are more affluent in the city of Chicago have. Next, I have been asked to join the steering committee of the Racial Equity Rapid Response Team. I know that Carmen is also on the Rapid Response Team, representing Esperanza. Carol Robertson Center and Bella, they're on Recovery Task Force. So a lot of our MSRN leadership is now on a lot of the committees within the city that are really dealing with the day-to-day of what's happening in our neighborhoods. So with that, I would like to introduce Bella Mote, CEO of Carol Robertson Learning Center.
Thank you, Luis, and thank you all for joining us this morning. We've heard a lot about MSRN's rapid response, like many organizations and networks across the city and the state. We came together, and so you've heard a little bit about how we mobilized and led with the belief and value that our community members know what is best for them. And then now we're like the state and the city thinking about the next phase of our work, which is really recovery. And how do we think about recovery in the face of the data that Carmen presented when we look at the realities of the zip codes that we serve, and what does that look like? And so the way that we like to think about this phase is recovering with resilience, and I'll talk a little bit more about what that means for the network and for our community residents. Here, health, education, and peace are the three tenets, if you will, of how we lead our work. I'm going to spend just a few minutes of your time this morning thinking about the health. What Carmen illustrated was that not only did we have to mobilize in Esperanza and Mount Sinai and several other partners focused on health came together to do what was immediate. Now thinking about sort of the short and long term, we know that access is a real issue. So how do we continue to sort of reduce the stigma of COVID-19 testing? How do we actually give access to community members in a faster, more organized way to get tested? How do we think about the realities of what this pandemic has surfaced that is going to stay with this community for a very long time in terms of their own health needs and the trauma that's attached to it? So as this network comes together to think about recovery, we know that health has to continue to be at the forefront, both in terms of the physical well-being of the community, but also the mental well-being of the community. Education, you've heard from Luis and Emma and Carmen that the digital divide is very, very real across many, many zip codes in the city, but very specifically to ours. And there's two components of the digital divide. There's the access to the internet and there's the access to the devices. We are now approaching the end of the school year. We know that very young learners, those who are birth to 5 and those who are 5 all the way through high school, have not been in a formal setting, receiving socialization supports, receiving sort of the regular school, and relying very, very heavily on their members of their family to help them navigate this new reality of learning remotely. But we also know that as we move into recovery, organizations like the Carol Robertson Center and many others who provide that daily support to young children and youth will begin to open up. So how do we provide the infrastructure and the supports to address learning loss? We don't know. We have some good understanding of how we'll work together to support the academic loss that has happened, but also to think about the mental well-being and what do we need to do to support our workforce collectively to make sure that they can address it. And peace, and I'll transition to the next slide, is part and parcel of how we think about the well-being of our community. So this focus, and when we think about the ecosystem, we really have to think about 2 elements of the ecosystem. One is how do we continue to elevate the profile of our community so that people have a very good understanding, not only of the data, but also about the fact that they know best. And so not only are we looking at our community residents, the adults in the community that we serve and have such great regard for, but the youth. The youth are telling us a lot of good things about what they need to happen. And so as we transition to the next part of our work, we're really thinking about 2 ways to continue to secure the resources that we need to do. But also to put the community at the forefront. So we are very fortunate that the data that Luis talked about from the survey, there were 2 things that were highlighted for us, and certainly the results in the pandemic have sort of surfaced the need for it. We're going to continue as a network to focus on health, education, and peace, certainly, but we're also going to focus on immigration and community development. For those of us who know Little Village and the community of Marshall Square, we know that it's a vibrant community. We know that there are a lot of small business owners, and development of those individuals and the community itself is going to take time to rebuild. So those 2 areas will continue to kind of motivate us, and will evolve in doing this. You heard a little bit about what's already in motion. We're addressing the digital divide and really putting our families and our community members at the forefront to design what that could look like. And the other thing that we're doing is really continuing to help our community members navigate these very, very difficult situations, empowering them to believe that they know what is best. And as they inform us what is best, we will continue to be ambassadors and stewards with that. So again, thank you for your time. This next phase, this recovery with resilience, we need partners like all of you on the call today. And we hope that you'll continue to engage with us as we come back to you and share what we've learned and what we've done in the recovery phase. So with that, I'm going to turn it back over to Luis so that we can engage in conversation. Luis?
Thank you so much, Bella. As I mentioned at the beginning, we really want this to be a dialogue. So I hope that you have questions for us, but I also hope that you have experiences that you'd like to share with all of us. So I would like to see, I'm trying to see if I can see everybody on the screen. Is there a way that we can go back to the full screen so that we can see everyone? Thank you so much. Feel free to raise your hand or jump in or send us a chat and let us know if you have a question. Or just tell us that this was the best presentation you ever heard and you have no questions because we covered everything.
Luis, I think there are a couple of comments and questions in the chat box already, if you want to start with those.
Let's start with those. Let me see. Lack of information. I'm so sorry. Everything just popped out of me right now. So
Luis,
yes.
I think this is Dan. I think I can address the one from C. Garcia. I'm not sure who C is. Maybe you know. But I think that this has been an ongoing concern, especially in the Latino community, that as probably most of you know, people don't understand the difference between race and ethnicity. That is, as the census defines them, that is not the way people understand their own identity. When you ask people in our community what they are, they'll say, I'm Mexican, or I'm Mexican American. They don't think necessarily I'm Latino. They don't know that that's an ethnicity, not a race. If they say Latino, they think it's a race. So those things have been really confusing, and that has been coming to the fore with this data since the beginning. And it's something that I don't think is fixed on the current census. And I think it's going to continue to be a confusion and something that has to be done. But I think that the public health authorities are well aware of it and are trying to think about ways to get more of that information on the front end, some of which is collected in sort of a ragtag way when the test is done, but then when it comes back positive, gets a little clearer. So that's something public health is aware of and that we need to push them on.
Wonderful. Thank you, Dan. And I will add to that, the census is a real big concern for us right now because of everything that's been going on. I'm sure you all know that in April, along with COVID, the White House announced an executive order on immigration. Again, now it didn't do much in terms of change things from the way they are, but what it does continue to do is it continues to push fear into our communities. And so that fear is making people not want to participate in anything that's sanctioned by the government. And so our challenge, particularly during social distancing, is going to be how do we get real counts from our community in this COVID-19 situation when we know that we have people in an administration that are really pushing anti-immigrant rhetoric. So that is another thing that we're worried about. Any other questions? Halish, if you want to ask your question, it would be a lot better than, I would appreciate it. It's a lot to read.
Hey, everyone.
I'm sorry. Hey.
No, thanks, Luis. Thanks for calling me out, Luis. I was, one of the things that's been coming up with a lot of our grantees and just in general is this idea of messaging and authentic messaging. So coupled with this question in thinking about how do you authentically message, a lot of people have been talking about the information that's coming at them and not feeling like experts. Anna, you had used the term experts in the field, and I'm curious how we're thinking about making the certain folks in the community experts to be ambassadors for information, especially since messaging is really so difficult and we just don't know. A lot of people are just either afraid to come for services or afraid to come forward or just not fully aware because they just haven't gone outside their networks.
So I don't know, Bella, Anna, if you want to respond to that.
Sure, I can start us off. So for the Carol Robertson Center, I think we're hitting on a couple of key points, right? There are the trusted anchor institutions that families go to for information and resources, and I think all of us within the network have served that purpose. And if we don't have the information, we go to, Anna or Luis and say, hey, can you provide X? So that's one outlet. The second is the families themselves. And I think that for what we have done at the Carol Robertson Center is we have a family policy council. And so we have charged them to become our ambassadors, not only to represent sort of the day-to-day things that are happening during COVID-19, but really equipping them with the information and then having them do two things. One, reach out to, 10 families a week and do a check-in with them. And then the other is we are having a town hall meeting on June 3rd, and that town hall is specifically for our families to talk about a couple of things. Reopening, what does that mean for their children, et cetera. And so that family policy council will have a role in ensuring that families attend the town hall, but also a speaking role so that they as parents can be the ambassadors to say, look, I've been lockstep with staff members on these issues. And I trust that Carol Robertson Center and the broader community are going to keep our children and our families safe. So those are a couple of ways that we're thinking about it, so that we're pulling on every lever to provide information, but also to ensure that we have the outlets in place where families who might not necessarily have those immediate relationships with me can have somebody else that they can go to. Does that answer your question?
It does, yeah. And I think just to add on one thing, because you were talking, Bella, about helping youth, especially with their learning capacities. How is messaging going out to youth, which seems to be the biggest community that information is just not getting to?
Yeah, so we have children, youth in our programs that we serve until prenatally all the way until 17. Prior to COVID, we have a youth council that we have. And so our Teen Reach program has really mobilized our youth council to help us understand some of the things that they're facing during this time, whatever stigmas might be out there, why they might not be wearing masks, or whatever that means for them, so that there's not judgment that's immediately attached to it, right? We know that there are a lot of reasons, including brain development, that the children are making the decisions that they're making, or the youth are. We're in that next phase of reopening. What we know is going to matter is that the friends have to tell their friends to come to Carol Robertson Center or to another organization, right? It's one thing for all of us, as wonderful as we are, to say, hey, you got to go, versus their peers saying that. So we haven't quite cracked the nut on how we're going to do it, but we know that that's going to play a vital role in our summer programming. To add to that, I think we have to really, I think, be cognizant, both as a network and as partners, that our youth are really, these last 8 weeks have changed their world. We know that youth, where they thrive and where they sort of come to life is with their peers, right? And they have been sort of cut at the knees from being able to do that outside of a screen. And so we really have to, as we reopen Marshall Square in the broader community, have to really think about what are the active ways that we can do that in safe, respectful ways, that I think the network has to begin to maybe mobilize more around, and certainly each organization then sort of carry that baton forward.
Yeah, and I'll say that there's still a lot of work to do. It's been difficult in a way to think about all of this at the same time, and then talk to family members and young people about messaging, for example, for something like the census, when people are worried because they're losing their jobs, or we have a family of 6 and 3 people have COVID in the house in a 2-bedroom with 1 bathroom. And so we've had to do a lot of that type of work, which is kind of the response part of what we've been talking about today. I think thankfully we have a really good relationship with the principals in our area and our network chiefs, both for the elementary school and the high school. And we've been in communication with all of them about how we can support some of the messaging coming into the schools and coming out of the schools. Currently, we've been meeting with a lot of the parent leaders and having similar conversations like the one we're having now, to hear directly from them about what they're worried about. A lot of it still has to do with response right now, but we are working with them. For example, some of the recovery, some of the financial support that's going out to the families in the community, those families, some of them are being recommended by our parent leaders. So, the idea is that the parent leaders know who their neighbors are, and they know who is in real need, because one of the things they talked to us the first time that we pulled them together was that they were afraid that people were going to try to take advantage of the situation and try to get funds when there are other people who really need them. And so they wanted to make sure that the people that really need them receive funds. So we've been working with them on something like that. I think also Open Center for the Arts and Omar Magaña is leading a project right now that involves 2 of the aldermen in the neighborhood and Yolocali Art Center in Little Village as well, and really talking about creating art with youth voice. But I think we still, part of it is we still have to invest more in that. I mean, it's really difficult to get young people and parents involved when they're thinking about paying the rent, or where they're going to eat, or how their health is doing. And so, there's a lot of work that needs to be done there, but I think we have a structure that will allow us to do that. We need a little more time, and we need more resources.
Please, I would add that we know that in order to really get a good handle on the pandemic, we need a fair amount of contact tracing work to be done. And as you think about the word ambassador and what maybe some of our young adults could do, that is a potential opportunity to not just get them engaged in what's happening right now with the pandemic, but even long-term engaged into healthcare professions. And so I think where we are right now and knowing what work still needs to be done, that's an opportunity that we're thinking about. How can we get bilingual, bicultural contact tracers to be part of this recovery and also to possibly have positive outcomes to their own careers moving forward.
Absolutely, that's a great point. There's another question in the chat which says, have you anticipated many long-term challenges or opportunities for MSRN members and the community members served? So I'd love other people to chime in here, but I'll say that there are a couple of long-term challenges that we have. I mean, we have consistently, I think the blessing that we have here is that we have a network that's been meeting for a long time, and there's trust built, and there are ways that we know how to work, and we have been very nimble and know how to respond rapidly. This is certainly something that we've have never seen before, but it's not the first time that our network has had to respond to an emergency. And so we've learned over the last couple of years how to work together quickly, and I think that's been a blessing. I do know that we've been having conversations about the ecosystems in our neighborhoods, because it's, I'm really worried about our local businesses. If we don't keep our local businesses going, what's going to happen in a year when we recover? We're going to have a lot of empty storefronts, and we're going to be facing another emergency. And so that is something that we've been talking a lot about, and why Bella talked about how we're moving into more community development. The other thing that I'm worried about, and I'm certain that most executive directors and CEOs of nonprofit organizations are worried about, is that we're dealing with the pandemic and emergency response right now. And I want to say to all the funders in the foundation world, thank you so much. I think you all have been perfect, great during this time. You all have released funds. You have allowed us to use our funds for general operating support. You've called, you've emailed, and we really appreciate that. I think one of the concerns within that is, at least for myself and other people on the call can jump in, is I feel like very supported right now, but I don't know where I'm going. I don't know what I'm driving towards. I don't know what Christmas is going to look like. I know in 2020, we're in a good space because of the support that we've received. I'm a little bit worried about 2021. And so one of the challenges that we're looking at is how we're dealing with this emergency now, and hoping that we don't have to deal with another type of emergency in 2021 that has to deal with, organizations being in trouble because of funding. And, as a network, and one of the things that Anna talked about, we were born because of the financial crisis that happened in 2008. One of the things that made me the proudest was that none of the organizations in our network closed down during that time, because our focus was to keep everyone open, to keep everyone employed. And as you can see right now, the biggest asset that we have in our neighborhood is the organizations and their employees. If we start to lose that in 2021, that's something that's really worrisome for us right now. I don't know if anybody else would like to add anything to that.
Luis, oh, go ahead. Go ahead, Dan.
Sorry, if I could add one thing. It's maybe a little narrow bore from the health perspective, but I think it's an incredible asset for the community, which is that COVID-19 has forced the insurance companies to allow telemedicine. And that has been a game changer for our patients, because our patients working in low-wage jobs can't afford to take time off to come to the doctor, and especially the 1 hour there, the 1 hour back, the waiting in the waiting room. We've reduced what takes 3 hours for a patient to 15 minutes, because we can do it on FaceTime on their phone. And that is really changing the way we do medicine. It's not perfect, because a physical exam is many times needed, but we're innovating and changing that. And that's something we really hope to hold on to, because it's such a huge gain for our patients.
Bella?
Yeah, I was just, Dan, that's an excellent point. And I just want to say that for the families that we serve, it's already coming up how much peace of mind they get from not having to take 4 buses to get to their provider. So I think you're raising a great point. I do want to, I think, Luis, your framing around sort of the unknowns are very real. And along with the community development and the organizations, the nonprofits that support, I think an important takeaway is that as employers, as Carol Robertson Center for Learning, we employ members of the community. So there's a double whammy that we have to think about, right, in terms of, what happens to the livelihood and the well-being when people start to lose the infrastructure that they've come to rely and support with. And then back to the question, the ecosystem, I think that for what subject matter expertise I bring as part of Carol Robertson Center for Learning is early childhood and youth development. And I think there are very real things that we're already seeing. There's learning loss that was in the community way before the COVID-19 that all of us were trying to support and address in terms of an opportunity gap. That is tenfold now, right? For the digital divide reasons, not having the supports needed to learn remotely, not having the socialization. But I think that all of us certainly recognize that there's learning that can only happen when you have a foundation of trust and support and social emotional development that's happening. And so as Carol Robertson Center, like many organizations, starts to think about reopening, I go back to, it was already stressful for young children and youth in our community. There was already trauma. And now they've seen in 8-9 weeks, their realities have changed dramatically, not for the better. So how does a trusted organization like Carol Robertson Center or other members of the network really focus on the well-being of the community from a mental health standpoint and a social emotional standpoint? Because at the end of the day, that is what I think will get us through some of those other stressors that we see, like domestic violence and gun violence and all of the things that sort of perpetuate the narrative of why people can't move forward. So I just wanted to offer that we're seeing lots of indicators of stress and trauma in this very, very short amount of time that I think will stay with us for a very long time.
No, thank you, Bella, for that. Before I go on to the next, Anna?
Sorry, I was just going to add one more thing. And sorry, there's some sort of like teacher school parade happening outside. So if you hear some honking, my apologies. But one thing that I'm thinking about too, I'm seeing things about funding issues in some of our government institutions with USCIS and that sort of thing. So a lot of the residents we work with were accompanying to civil court cases or immigration hearings and interviews, and what's going to happen given that all of this has been put on hold, and how are we going to be able to ensure that those needs are met when we return, and what's going to be kind of the long-term impact of potential reduced capacity in some of these institutions that I think will pose a real challenge to some of the residents.
Thank you, Anna. And before I go on to the next question, I do want to address another opportunity. I think there is a huge opportunity for more collaboration. I think the town hall meeting that we had with the mayor last week was an indication of how organizations that serve the Latino community throughout the city are able to come together really quickly. And when we had our first planning meeting, it was beautiful to see that we had organizations in South Chicago, Archer Heights, Brighton Park, Little Village, Humboldt Park, Rogers Park, Belmont Cragen, and everyone was talking about sharing, and everybody has one mission right now, and it's to get through this pandemic. So my hope is that collaborative efforts like that go beyond just the one organization and even just the one community can continue, and we can build on that for the future. The next question that is on here is, earlier this year, you were concerned about rising rent levels in Little Village and the MSRM geographic area. Has COVID-19 had any effect on that issue? Is it too soon to tell? I've been talking a lot, so Anna or Bella, does anybody, Carmen, Dan, would you all like to jump in here, or I can go? So,
Go
okay,
ahead.
Stella, after you.
I think for us, it's a little too soon to tell, just because there were some, concessions that were made and agreements that, people have held. I think, again, back to Luis's point, the unknowns, I think this is a real unknown. And when we think about the multi-generational households that we have living in one apartment together, the implications of any kind of change are just very, very real. And so we are already hearing, while nothing has significantly changed in rent or anything like that, we are hearing from our families that this is something that they're very worried about, in light that, three members, the three adults in the house of six, have lost their jobs, and they don't know how quickly they'll be able to find new jobs. So I think it's certainly looming, even though the data doesn't allow us to tell the story as of yet.
I'll add to that the other concern as it relates to rent, I think we're in a unique situation right now in that everyone knows it's difficult to raise the rent right now for anyone because of the situation where there are not a lot of people that have jobs or extra income. It doesn't mean that that's not coming. But I will say that one thing that is really frustrating, and it's something that we're trying to figure out, is the fact that the undocumented population received $0 from the Federal CARES Act, and they are not eligible for unemployment. And even we have some business owners that had thriving businesses who are employing people in our community who are not eligible for some of the federal dollars that came down. And we're learning as time has gone by that, before I go on to that point, if you were married to somebody, if you filed taxes with somebody who's undocumented, even if you were a U.S. citizen, you're not eligible for some of the funding. But we're learning that even there are a lot of our seniors and a lot of people who are immigrants who do have authorization to work here legally, who are eligible for these checks, they have not received them. And so you have to go online and do your thing there. And our seniors and some of the immigrant community, they don't know how to do that. So even some people that are eligible for the money, they're not getting the money right now. And that's another issue that we're dealing with in the community. I think we have time for one more question, or if anybody has a comment, we'd love to hear from you too. Has anybody seen or heard anything in the foundation world and working in other neighborhoods that you think that you'd like to share that would be something that we can learn from?
Hi, Louise. It's Diane Watton. Can you hear me?
Yes. Hi, Diane.
Well, I wanted to congratulate you and everyone on this panel for your leadership. It's been, we know or have some sense, we don't know, but we have some sense of what this crisis has meant to your neighborhoods. And I just want you to, I want you to know that as a corporate community, we're having dialogue about it all the time. So we have your back. That's what I'd like to say.
Thank you so much. I really appreciate that. That means so much to all of us. And I can't tell you, like I said, we have been blessed in that our partners in the corporate and foundation world have been extremely patient, extremely helpful. So I want to say thank you, Diane, to you and to everybody who's part of this call, because you're on this call because you're a partner of ours, and every one of you has contributed in some way to the work that we're doing. We're all extremely thankful for that. Thank you so much. And actually, for the last thing, and I'm hoping, Anna, maybe you can talk about this. Can you speak a little bit to some of the work that's happening in our Peace Committee around the domestic violence issue?
Definitely, yeah. So when our Peace Committee met for the first time sort of in our remote environment, we were hearing from some of our providers that they were really struggling to find shelter for individuals who were experiencing domestic violence. Certainly, I think that first hurdle is even just approaching someone to ask for the help and then getting ready to leave a situation of violence, but then to have somebody ready at that point and not being able to offer them a space because shelters were either full up or they had reduced their numbers because of needs for social distancing to allow for that. So we did convene a sort of subcommittee of our peace committee to talk about whether there were advocacy things that we could do to see if there were opportunities to increase capacity for domestic violence victims. And luckily, around that same time as we were having the conversations, the city came out with the news about the partnership with Airbnb and hotels. But then even so, it was the next step of, okay, but how do we make sure that our residents get access to those opportunities? And luckily, we have a few of our domestic violence serving organizations who had been a part of that discussion with the city and we're part of that network to help the rest of us navigate how to make sure that our families access to that. So I would say what I'm hearing from people is that it has significantly improved access, but it's been really helpful for us as organizations to continue talking with one another to figure out how we ensure that continued access. And it's sort of like, okay, I was there for a week, now I have to figure out how to renew and who do I talk to and how do I make sure that I get access to food if I've been placed in a hotel that's out, miles from my original community and that sort of thing. I think that the barriers are still how do we ensure that they're getting access to orders of protection and things like that. But happy to say that initially, at least, it looks like shelter has been something that we've been able to get more access to.
Thank you so much, Anna. So I want to be respectful of everyone's time. So in ending, I just wanted to remind everybody that this is part of a series, Respond, Recover, and Rebuild. So we hope that we can continue this conversation with all of you. I want to say thank you to all of the organizations and the Marshall Square Resource Network. I think we've been doing just an amazing job of working together and getting resources out into the community. And thank you so much to all the funders. Like I said, you have all responded in such a wonderful way, and we're blessed to be working with you. And I will ask that we continue to treat each other in this way as we move forward. One of our goals within the network is to check in with our partner agencies to make sure that we're taking care of each other mentally, physically, making sure that we're not burning out our employees. I'm hoping that you in the foundation world are doing the same thing. And please continue to reach out to us because we want to hear from you. Please share our story with your peers. And if there's anything else that we can do to help you in your work, or if there are other people throughout the city that you want us to connect with to share information or experiences, we're all partners in this and we're all going to get through this together. And I'm so happy that we're all working on this as one community. Thank you so much. And I hope that you have a wonderful rest of your day. Bye, everyone.
Thank you.